Hello, good evening. My name is Dr. O, and welcome to Health Caring Differently, where we inspire diverse students to explore careers in healthcare. Please tune in every Tuesday at 7 p.m. Eastern Time, just like tonight, and follow us on all of our social media platforms to stay in the loop, gain valuable resources, and hear more about the next episode. Now, I really also want to encourage you to go to healthcaringdifferently.com and sign up for our newsletter for information on diversity programs, scholarships, and research opportunities. So, tonight and every episode is about inspiration. You're going to hear stories, but then to get into the action, to be able to explore careers in healthcare and be linked to mentorship, you need the information. And so that is on comes through our newsletter. For tonight, feel free to drop your questions for our guest in the chat, and I will be sure to ask them for you. All right, so today's guest is Dr. Kwadwo Kyeremanteng. He is the department head of critical care at the Ottawa Hospital, where he cares for extremely ill patients in the intensive care unit, ICU. Dr. Kyeremanteng has founded the Resource Optimization Network, which is a research group working to reduce healthcare spending without compromising care. He has a podcast, Solving Healthcare with Dr. Kwadwo Kyeremanteng, where he features interviews and discussions on the topic of improving healthcare delivery in Canada. During the COVID-19 pandemic, Dr. Kyeremanteng created Solving Wellness, which is a virtual health wellness platform for healthcare professionals. And in 2023, Dr. Kyeremanteng became a first-time author with his book, Unapologetic Leadership, and has recently been asked to join the board of governors of the Ottawa Hospital Foundation. Welcome, Dr. K.
Oh, Dr. O in the house. I'm so glad to be joining you. This is a true pleasure and privilege, and I just an absolute pleasure to see you.
Oh, I love it. I mean, I've been looking forward to this for a while. I mean, like I was on your podcast, a couple years back, and it's just awesome to be part of innovative work and to work with somebody like you, and hopefully we can inspire some youth today. So you're with Dr. O and Dr. K. So okay, let's get into it. Okay.
It's better than KO, I guess, eh?
I guess I already thought a lot about the KO, like the TKO, the KO combination. So yes, I thought of it both directions. It's a fantastic combination. So we're just gonna jump like right into it. Like I just like leap. And so I'm just gonna ask you straight up. And I know you did in the video, but I want those who might have missed the video. How, Dr. K, are you health caring differently?
Yeah, there's a few ways I think I'm health caring differently. I
Multiple.
multiple ways. I'll tell you what I'm most excited about these days is I really am emphasizing the lens of preventative health, of being proactive with the way you approach your health and wellness. Because I've seen too many people either not like die in the ICU or have significant morbidity or disability as a result. I've seen families just broken apart from landing in the intensive care unit, and a large portion of the patients that we see are related to lifestyle choices. So obesity, type 2 diabetes, high blood pressure at times, and so to me, one of the most clear, impactful ways of improving people's lives, reducing healthcare spending, is talking about how to avoid seeing someone like me in the intensive care unit. So that's been a real, true passion for me. And I don't think you'll see too many ICU docs talking about how we eat, how we move, how we reduce our stress, and the need for community.
No, you know what? And you're right. I was just thinking about that because like my specialty is public health and preventive medicine, right? So it really is about prevention, but usually at the systems level or policy change and those type, like how we could do it at a society or community level. But we do end up seeing trauma surgeons, sometimes emergency doctors, pediatricians, and sometimes psychiatrists become interested in prevention. I have not worked with an ICU physician, a critical care physician, spending time and passion doing this work, and definitely not on social media. So I think the work that you're doing is phenomenal. Like y'all need to go to his website, right? Y'all need to go to Solving Healthcare because it's like even the website is like just it is healthcaring differently. All of it, your whole approach and it's
Thank
inspirational.
you.
So thank you for doing
Well,
that,
thank
letting
you,
people know
Brittany.
the things that they can do. But I mean, let's talk about the journey though, right? Because you don't just come out of med school and have a dream of critical care and an ICU doc, and then come to the point that you're describing now. It's a journey. So I'm gonna
Mm,
rewind and let's take you back to the pre-med days, right? And of course, being a person of African descent, we're underrepresented in medicine. So can you tell me a little bit about some of the challenges that you might have had to overcome, either in your pre-med or early med journey that helped to shape you and your work today?
yeah, great question, Dr. O. I mean, I grew up in Edmonton, Alberta, so there wasn't much in the way of diversity, especially for Black folk. Period.
Yes,
You know,
back then.
yeah, like I faced a lot of racism growing up, especially I was a hockey player, so that was a go-to for a lot of people when they wanted to try and get you off your game was refer to racial slurs and so there was a lot of adversity throughout life, and then when it came to medicine, several things come to mind from the adversity side. Obviously, there was no mentorship. I was one of two Black students, and when you don't have anybody that you feel like you could relate to or have that shared experience, it's hard to navigate any challenging time. And so that was to me an uphill battle. But and then there would be some situations even with the instructors. I remember one instructor referring to making condescending statement about people from Africa and really obviously putting me in an awkward position because you're
Mhm.
trying not to piss off people, but at the same time you want to stick up for your people. So yeah, that there was always a lot of adversity, and what I like to teach our kids, like we have a Black mentorship program, which we'll talk about at
Yeah.
some point, but
Well.
it's like to embrace that adversity, use it as a weapon, because
Mhm.
when you get to overcome those barriers, those systemic barriers, and the lack of resources, the lack of support, you become impenetrable. You become like there's nothing that could stop you. And so, as much as I would have loved to have had mentorship and had some guidance, it's probably why I'm here talking to you today. And so, yeah, I mean, that was some of the adversity. I chose critical care because it's just my nature. I love high stakes
Woo!
scenarios. I like not knowing exactly what I'm going to walk into during the day. I like that like predictable unpredictableness. I
Yeah.
love it. And so and then I got into my field of research was always looking at how we can improve the efficiencies of a healthcare system, and which short version tied well into the preventative side, because we were doing these papers on you do this fluid instead of that fluid, oral
Yes.
antibiotics or the IV antibiotics, and you're saving like thousands of dollars. Whereas an ICU admission, for example, if it was during the pandemic, that was a $50,000 admission. So if you could prevent a few of those, think about the resources that would be available for preventative health. So
Yes.
I that was abbreviated version, I guess, of my journey into critical care and my area of research and why I'm passionate about preventative health.
Yes, and I mean, I love that there were so many things to unpack there, and soon we'll have the student questions, but I'm going to unpack some things in there. I mean, the adversity that you face and being able to channel it into a strength, which really has turned into a superpower, is a beautiful thing. That doesn't always happen, and I think where resources are available to us, fantastic. Let's use them, but where they're not, then it's like finding a way to you know convert. I call it turning pain into purpose, right? Like just
Mm.
finding a way to convert that so that becomes part of your mission. And now you're involved in mentorship. You didn't have that mentorship, but now that's created your ability to design something knowing what the younger you would have benefited from, and that's a beautiful thing. But the other thing that strikes me is like one of my other like common sayings or mantras is like you're talking about being in a marginalized group in Edmonton, like being one of, few Black students and coming from a community, like we're talking about being African, being Ghanaian, where that's a group that experiences a lot of discrimination. And so like I feel like you embody this so much. What I say to some of my mentees is like, look, when you enter spaces with people who are part of the dominant group, who have had more or who have had more privilege, sometimes you can feel intimidated. But I'm like, at the end of the day, when it comes to leadership, a lot of folks struggle to think outside of the box. But I'm like, we were born outside of the box. We're not struggling to think outside of the box. We come from people who find a way out of no way. And so when it comes to leadership, it can be a beautiful thing of what you have to bring to the table. And I'm like, bruh, like yes, you like way outside of the box with regards to the work that you're doing, but also the impact that you're having. So
Oh, well, oh my goodness. Well, thank you, Dr. O. Like, I gotta say, I've never thought of it that way. That's why I'm a bit taken aback that we have always had to think outside the box. You had to be resourceful. Because I would say at a personal level, I always say that's one of my superpowers. And I talk about the need for this as in my book about the ability to think outside the box and to have a culture where it's safe to think outside the box. Because yeah, I really like that framing of it. It's because a lot of us have had to not, we don't always fit in a no pun intended, a niche or a box that
yeah.
people want us to. And so to get that much further ahead, yeah, you got to reach out. Like I mean, my other jobs in palliative care, I did echo training. I did a master's in health administration.
Wow.
I, was one of, I don't know if any ICU doc, well, no, there was a couple ICU docs that were involved in research around costs within North America, but there wasn't many of us. But yeah, and then none of them have a podcast plus a book. Like it
That's
was really, you know what I mean? Like it's so good. Yeah, it's a great point, Dr. O.
No, I feel like that is really the embodiment of you and your work. And that's part of why we have health caring differently. It's not just that we're different, it's that we approach things differently because of our lived experiences. And
Mhm.
so, I mean, why don't we even just dive in a little bit into the mentorship program as well? Because I want students to hear about that, because you're doing, again, another example of how you're doing things differently. And I think students would need to hear about it. And of course, we're welcoming questions. I realize, just letting you know, Dr. K, it is election night in the United States. So, I think folks will be in and out, but I'm hoping that we have, a few good questions. But please go ahead and let's talk about your work in mentorship.
Yeah. So thanks for highlighting that. This was post George Floyd. As a Black physician, I was always trying to fly under the radar, be unnoticed, not cause any trouble, just because we could maybe talk about this as well. Like you're a target at times.
Oh, yes.
And I've seen that, especially in leadership positions too. It's anytime you're not among many of you could be a target. And
Yes.
the short version was like I really felt the need to do something more, especially after interviewing Dr. Oh my
Chica.
goodness, Chico Oriwa. Yeah, sorry about that.
Okay, but I
I,
know who you're talking about. Shout out to
you know already, yeah.
Chica. Yes, go
He
ahead.
was like a pure inspiration who's going to be the future like prime minister or something or bigger.
Absolutely.
By the way, yeah. And one of my principles is like no analysis paralysis, just do something. So I said to my group, I'm like, we're starting a Black mentorship program, I don't care. And it was garbage. It was bad form on the website. We had 3
Oh.
students. We had one named Kwadwo as well. and we just iterated. And my big thing was, you see all these mentorship programs where they like pair you up and here's some advice every once in a while. I was like, no, we're going to make sure your CV is bolstered. We're going to give you lots of opportunities to be able to shine. So through either through my research, through the podcast, through the Black Mentorship Program in general, like being a coordinator or something, we gave titles to folks. We were going to make you shine. And that was my big difference between other mentorship programs. So we provided a lot of opportunities. And I got to give thanks to my team. So Patricia, Dr. Oh my goodness, my brain is not working today. Dr. Christina, Mary Christina, and Tasha, organizing things like review of applications, mock interviews, all these things to prep the kids. And out of like the 25 mentees that we got in there, I think 5 got into medical school this year. Last year was the year our very first mentee got in. He got into 4 schools. And so we are shining. We're representing and shining. You know what I'm saying?
I love this because oftentimes for us, and especially as doctors or people pursuing medicine, sometimes people are afraid to try something new because of our need for perfection, right? And I love how you describe that when you started off, it was like not good, right? But you were committed to quality improvement. And so I think obviously when we are, with our grades and sometimes with certain medical pieces, we definitely want to aim for perfection or excellence or the highest level. But sometimes when you're doing something to create change, the biggest thing is, as you said, just starting and then having that commitment to quality improvement, right? And then so look at where you were before and then you see, you know what I mean? You have a vision where you want to go, but it doesn't have to start off perfect. It's progress over perfection. And so I think that's a beautiful thing because you don't want to get into analysis paralysis. You want to go and you are having impact. It just takes a little time and you've done it. So
so thank you. And it's so good because if you did nothing, I just feel like you're going to be that much further behind. So tons of things I've done that I would have done differently, but I am so grateful for this approach or mindset. And I reinforce this to the kids. Go. If you're thinking about something, you're thinking about a passion, do it.
Absolutely. I love it. I love it. So we do have a question from the audience, but before I go to the question, I just want to say that we will, I know it's already on your website for the mentorship program on solving healthcare, but we will in our newsletter provide details for that. And right now we're reaching out to a lot of researchers to also put out different opportunities across the country for Black and other marginalized youth. So we will follow up with you, Dr. K, for the fantastic work that you're doing. So we'll combine forces. So we've got a question from Amber Claire. And so she's asked, with regards to your work on educating patients and your work in palliative care and dealing with families, there's a strong emotional aspect here. Is this taught in medical school?
That's a very good question. I must say my time and I've been pretty distant from the medical school teaching, but from my personal experience, these are things that are mostly taught while you are doing your rotations on the ward. Because it's one thing to read about having these difficult discussions. It's not going to be the same until you actually do it yourself or witness it yourself. And it's hard. It's not, for some people, it's harder than others. Like, I think I was able to do this as a profession because I don't take things home very often. It's not always, right? Like you have to, by the nature of the job, especially not so much on the palliative care side, but on the ICU side, you have to compartmentalize. Like if I'm just finished a family meeting, just telling a loved one that there are a family member that their loved one's not going to survive. And then 2 minutes later, there's an acute trauma or a GI bleed that's coming in that needs my full attention, my full focus. It's not fair for me to be thinking about that difficult discussion that I had. So I think we all have our own ways of coping. My big thing is you reflect on these things at some point, and it could be the same day, it could be the next day, but reflecting on what you saw, what you went through, and what the meaning of it is, and I'm not afraid to be emotional with patients either. Like especially
Oh,
after losing my own parents, like I find that sometimes these moments are even not. I'm more empathic than I've ever been,
mm,
and I'll often reflect on my personal experience too. Like, if if they say something like, "Oh, should I come in? Uh, should I ask my brother or sister to come right now?" And I said, I'll often say like, I didn't get a chance to be with my father when he passed, and I would have done anything, right? And so like really leaning on this on your personal experience without being too over the top, obviously, but
mm.
um, I think being relatable, being empathic, very important, but also being able to turn it off when you need to turn it off.
I think that's very powerful. And I mean, perhaps not everybody is able to turn it. That might be one of your superpowers and why you are well suited for that area. But I think I love the way you're intentional about it. Like when you're present, it means that when you're present, you are present. Like you are present with that family. And then when you're called to another piece, you're able to be present and in flow to be able to save another life, but then intentional about coming back and reflecting on that. But I'm really intrigued about what you said about, oh, and we have another question, but I have a follow-up for you. I'm just really intrigued what you said about um talking about your own life with your patients. Now, there's an art to it because it has to be said in a way that is going to help a patient. So it's not about making it about you, but having that, as you said, being relatable and having that human connection. Now, I'm guessing you were in medical training around the same time that I was. And back then, um, you were taught like you are the doctor and that is the patient and you don't share anything. Like I remember training in psychiatry and being taught like when the patient is crying, then you just pass the Kleenex box. Like this move. I remember this move, learning this. So how did you decide to break that and share more of yourself? Or did you have somebody who, in your training who told you you could break that? I don't know.
Yeah, good question. I think it's about health caring differently. I think it's like I we all have our own kind of talents and attributes. I feel like I can relate to what that patient is going through or that family is going through. Like put yourself in that shoe, even though if you've never gone through that, hopefully, but actually take a second and imagine your wife just had a catastrophic bleed in their brain. Imagine your brother just got into a car accident and is brain dead. Imagine how you would want to receive the news from that physician. Would you want all right, pass the Kleenex box and be robotic? Or would you want somebody that's looking you in the eye, holding your hand, hugging you if you need it, um, and knowing that you're there and caring and listening and being by your side during the toughest moment of your life, right? And so to me, I don't even know. I'm not even sure if it was conscious or not. And I know I've seen other people before me that, like I think of someone I looked up to in palliative care, Dr. John Seeley. He would put his hand on a patient's arm while he's talking to them and be so present, make you feel like you're the most important person in the room. And I've always wanted to be like that. That to me that's true medicine because like
Yes.
we're human. Like you want to connect. Like think back of why you really wanted to be in this profession. It's a grind. It's hard. You're gonna feel like it's not worth it at times. But the why, reconnecting with your why, what it is because you want to help. Uh, you want to be a light for people in good and bad times. So yeah, to me, it's not even I'm not even questioning.
Oh my goodness. I that is so powerful, and I think that is, connecting with your why, right? Connecting with your why is what you need to walk into this journey of medicine, and then you need to come back to it on a regular basis. I love that. We do have another question. So Tracy Apia Kubi asked, does your program also offer mentorship towards residency matching? So
Yeah,
when
that's a
people
good
are in
question.
medicine.
Yeah, that's a good question. So typically, no. Like informally, of course, when the kids go through, are they going to get some support to try and navigate these things? Absolutely. But I really wanted to put our eggs in the basket of getting us in, getting some representation. Because if I've learned anything over the years, is that representation matters. I
Mhm.
can't like just a quick story, if I may. I walking through the emergency department and I see this young black woman with sickle cell crisis asking for pain medication, and a lot of black women traditionally, just not a stereotype, but some of them can be quite stoic with their pain and not like
Yeah.
not scream, but like
Mm.
I'm in pain, right? Like just I've seen it too
Strong
often.
black woman stereotype.
Yeah.
We also perpetuate it. Yes.
Yeah, right. And so I could feel this. This is a situation, and then I basically, when the nurse was like, I don't think she needs anything. I said, you're gonna get her some pain medicine. She's asking for pain medicine. She's in a sickle cell crisis. This is ridiculous. Like, check it. And if there isn't people that have that understanding, what are some of our people go through, uh, like then we're not providing optimal care. So I this is, to me, even I know this is for the youngins, but leadership is even more important, man. Like if I'm now that I'm on the other side, like the policies that could impact people at scale, dear Lord, yeah, this is when representation truly, truly matters.
Yes. And I have to say, there are policies that have come into place in a number of hospitals. I know in the Greater Toronto area about wait times for sickle cell patients. Anyway, so there's starting to be change in that regard, but so much that is needed. So yes, thank you for bringing up leadership. And to Tracy Apia Kubi, the Black Medical Students Association of Canada, the Black Physicians of Canada, and the Black Physicians Association of Ontario provide mentorship towards residency matching. So we will put that in the newsletter, but you can also follow them and DM them as well. All of us have to kind of deal with our different slices of this great pie when it comes to health equity and disparities and making our impact. So we are part of a network, part of a village, part of an ecosystem to support you in different ways. And so the questions are pouring in now, Dr. K. This is always the case. It's always at the end. It's like the doctor, I have chest pain when like somebody's holding the door.
Yeah, I'm bleeding from my pelvis as the
Every
doors
week.
open.
All
Yeah.
y'all students always ask questions at the last minute. Are you okay for another like 5-10 minutes?
Yeah, yeah, yeah.
Three more
Yeah.
questions came in like at
Yeah.
7:29. Okay, so Yursky, who is like on this every week. I appreciate you, Yursky. Yursky asked, what's the hardest part about working in critical care?
Yeah, it's a good question. I, maybe I'll list off a couple things that come to mind, and then maybe I'll think of the hardest one. The the unexpected, the unreasonable expectations. Like we have some people with late stage cancer, 89 years old, have all these bad things happening to them, and families are expecting them to, like, a miracle to happen, and you see them suffer with all, because like what we do is not easy on patients, and it's got to be worth it. And often the writing's on the wall where they're not going to survive, they're not going to have a good quality of life, and there's not always, we're not always seeing eye to eye with the family. So that's one really hard part. The working in a fatigue state, like I mean, I'm not getting younger. These ICU weeks are getting more and more tiring, especially as a father of three and active kids, and so like that can be a bit of a challenge. And like every once in a while, you have some like mega tragedy happen. Like it's just like it just hits too close to home. Like for me, it's young moms. I I don't do well with young moms. Like when they pass, like I have a visual of almost 10 years ago of a mom dying from her breast cancer, holding her 3-year-old son in the ICU. Like that. Oh, like that to me was yeah, just a little too close to home. Because when moms go, it's just like there's the community, there's the kids, there's the siblings, their parents usually are still alive, like the spouse. It's hard. Yeah. So, but if I were to pick a single thing these days for me, it's the battles when it comes to goals of care when we don't align.
Yeah.
It really could be draining.
Yeah. No. And those are very difficult conversations. I'm gonna flip your question, Yerski, and I'm gonna say, okay, on the flip side, and then we have one more other question. But on the flip side, what are the best parts of critical care?
Oh man, the best part. There's so many, but I love the working as a team, especially in a crisis situation. Like if you got like an acute bleed, I often give this example to the trainees when you come in. You know, you like ICU if you had a wicked upper GI bleed or some kind of trauma where you have to resuscitate the patient, because this is when you gotta be thinking 3 steps ahead. You have to communicate well. You have to be coordinated with your team. You have to be on, right? Like make sure the blood is there. Is your ratios good? Is your access good? Do you have to do a crash line? Do you have to intubate the patient to stabilize them? Do you need services on board to help control the bleeding? Like you have to be ready and on. And when it goes smoothly, it's just so beautiful. Like it really is. Like when you see that, it's almost like it really is. It's art. When you see the team, 13, 14 of us in the room, just doing our best to stabilize the patient, working in harmony. It is like I always get a little bit of chills every once in a while now that I don't know why, maybe I'm at this stage of career where you could reflect a little bit more. But yeah, I just think it's so grand when this happens. And so yeah, I really feel like I have one of the luckiest jobs in the world.
No, I love that. I mean, I'm picturing, the recess happening and it almost like like an orchestra. It just seems like
Yeah.
you were the commander of and then it's all happening and then you save a life, which is like just so rewarding. Working in public health where we're trying to solve like obesity. Like I don't get that kind of rush and flow like you get. So I'm living vicariously through your story. But one thing, so the next question actually touches on one area where for public health, we are in flow. So it's not when a GI bleed comes, but it's when we have a public health emergency, like the pandemic. For me, it certainly was a marathon as a public health physician. But today I was talking to a colleague and I described it as a beautiful nightmare because there were so many, as you said, like the teams and the collaboration and the problem solving. So the next question speaks to that. So I know how I was kind of in flow, but in a very long, drawn out way during the pandemic. But the next question was from Hey Harmela asking, how did the pandemic influence or inform your approach to providing holistic care?
So first of all, which will be how I tie into things. When I do that, my harmony, I'm affecting one life, but when you as public health folks get a message across, you're impacting hundreds, thousands of lives, depending on what it is. So remember that. That to me is where, like, to answer this question directly, it was the whole thing was the pandemic. I wouldn't be here talking to you about preventative health and the holistic care if it wasn't for that, because I saw people with metabolic syndrome coming into the ICU, so obesity, type 2 diabetes, dyslipidemia, or cholesterol that's off. And I slowly came to learn through my podcast and some of the thought leaders that a lot of these things were reversible. like we can get a message out there that there's incentive to get healthy. And this was especially pre-vaccine. So this is when I was extremely motivated to talk to people about getting healthy. And so that was the pivot. Like I wasn't on my radar at all. I was focused on what's the latest evidence on which pressor to use in what circumstance, and like all the nuance of critical care medicine. But this to me was a huge aha moment for me that I'm super grateful for, because as I was alluding to with Dr. O, when I get a message from either the podcast or social media saying, because of your messaging about metabolic syndrome, or you saw this posting on protein or fasting or whatever it might be, my mom is off her diabetic meds now and is thriving. And when I hear that, I'm just like, man, like, because you don't, like, when you think about the scale of what that really means, the trajectory for that person's life, it is massive. And this is why I'm doing stuff like this now. I'm active on social media. I do normal media appearances, write a book, start a supplement brand. Like, we did all these things because it makes a difference, and it's a difference at scale. And so to answer the question from, hey, Hamela, it's that the pandemic was everything for me for that. Like, it was, without the having to see what I saw during the pandemic, I wouldn't be having maybe I wouldn't be at this stage talking about this as much as we are now.
Yes. No, and I love it. And honestly, like where you talk about the diabetes, that's the piece. So for me in my work, yes, I work at the population level, but when I work with patients, it's to help them like either with addictions, like, quitting smoking and things like that. But my early work, at Taibu Community Health Center, which was the center for focusing on Black communities, what, like, my favorite part was deprescribing, because if you help people with the lifestyle changes, then they come off of their diabetes medication, their hypertension medication. And I think a lot of people think you have to be rich to do it, but actually, no, there's a lot of, like, I'm like, please, like, the fried chicken does not go well with like the racism and stress and everything that we're facing in our communities. Like, let's go back to the rice and peas at least. You know what I mean? Like, let's not just a little bit better. Let's find the okra. Let's, you know what I mean? Things that are not expensive. So I love how you're talking about how you're doing that work. And again, it's not a class thing. It can hit every level of folks. So yes, hey, Harmela, thank you for the question. We get more questions though. So but thank you, Dr. Kwadwo, because like helping people deprescribe and get either on the lowest dose or eliminate that chronic disease medication is such a beautiful and empowering thing to help people with. But now we're going back to the ICU. We got a question from Tracy Apia Kubi, and she's saying, how long did it take to feel confident and comfortable as an attending in the ICU? Do you still get super nervous?
That's a very good question. So I used to get a lot of like anxiety before ICU weeks, and part of it, this is one of the things that I think in hindsight is related to being a Black physician. Like, you can at times have less allies. People are waiting for you to fail, so you feel like a lot of pressure to be able to be flawless. And so going into a week, I'd often feel quite anxious. Not like the night before, I wouldn't sleep well at all. These days, way more comfortable than I used to. And it's not often the patient side. It was almost like the perception of your colleagues or the consultants that would make things a little bit more stressful. But yeah, nowadays, luckily, I've been practicing as a staff person since 2010. At this stage, I am not a spring chicken anymore. So it's you get very comfortable with managing a lot of these patients, but sometimes every once in a while you get into these clinical situations where you're like, you need to call a friend. I'm like, I don't know what's going on with Mr. X. This is not behaving the way it's supposed to, because a lot of your comfort is in pattern recognition and being, and so through experience. And luckily, I was once again, because of having to always do that 25-50% more than some of your colleagues, I've done a lot of reps. Like for a while there, I was probably the most clinical ICU, like doing the most weeks in my city. But now with my admin position and things like that, I definitely have slowed down. But yeah, even you do get nerves every once in a while still to this day.
Yeah, and I think that's part of being human. It's part of the journey. But I definitely hear you in feeling, the pressure to perform in a certain way. But I also loved what you said about calling a friend. And I think now, particularly as medicine has become and is becoming more and more diverse, and there are also more allies who are open about being, like real allies. I think for those of you coming into medicine, it'll be a little bit different in the sense of having quite a few friends that you can call upon, even if it's if it worked out, it didn't work out, or whatever you're facing. Having that peer support is key. So I'm glad that you have that, Dr. K. And I'm encouraging those who are coming up to seek that from people who look like you and who do not look like you, but find safe people who you can turn to for assistance. So I think that was our last question from the audience. So I have one last question for you, Dr. K. And so what advice do you have? So I have, I'm here giving all this advice and stuff, but what advice do you have for students who are early in their journey? Some of our students aren't sure that it's necessarily medicine that they want to go into, but they're feeling it in their spirit, in their heart, that healthcare is the direction for them. There's a lot going on in healthcare right now. So what is your advice to them in exploring this journey?
Yeah, it's a good question. I would say if you got an itch for being a physician, so many doors are open for you if you go that angle. Like you're hearing 2 docs right now: public health, ICU, palliative, internal medicine, family physician. Like there's so many angles you could go for just from the clinical side. Then you have so many doors, way more doors open for you as a researcher when you have that MD behind your name. You could be, if you want to do something on the entrepreneurial side, having an MD behind your name. We talk about a lot of people that look like us thinking outside the box. Yeah. Like having that MD side definitely can help out from that perspective. You just have so many doors that are open, and your options are endless compared to if you say you did that PhD. And don't get me wrong, like if you want to do nursing, physio, a dietitian, all these things are great. And if that's where your calling is, you could do all the same things that I've mentioned. I just think when you have that MD though, you attract more, and there's less hoops to try and achieve your goals. So if you have that itch and you're serious about it, it's a journey. You're gonna have your ups and downs. You're gonna be tired, but it is magical. Like I feel like I'm one of the luckiest people in the world. You from a job satisfaction, from you're automatically a role model instantaneously.
Yeah.
Like it's like, think about that. Think about where you're your stage now, but think about 4 or 5 years from now when somebody your age comes and sees you and they'll be like, wow, teach me more. And like that's powerful. That's supporting your community. So my bias, if I'm being honest, aim high. We need more of us in the driver's seat. So that's my philosophy.
I love it. And yes, we are underrepresented. And so, as you said, representation matters. So if you do have the calling to serve as an MD, please enter the call. Dr. K, how can folks follow you? Where should they be following? Because you're on social media, you're doing your thing. They need to catch it. They need to watch it. Tell folks where they can find you.
Once again, Dr. O, thanks for the opportunity. I would say we're most active on Yeah, on almost all social media. So if you go to @Quadcast, KWADCAST, you'll find us on TikTok, Instagram, YouTube, Facebook,
Yes.
and X.
Yeah.
We have good material on LinkedIn. Podcast is Solving Healthcare. We have a newsletter as well on Substack. Books on apologetic leadership.
Yes.
Supplement group is Guyana. And yeah, we're changing the world. We call it changing the boogie because the boogie's got to change. You know what I'm
I
saying?
love the boogie. All right, we changed the boogie. I love it, and I'm calling it a movement because wow, literally and figuratively a movement. So thank you,
Let's go.
Dr. K, Dr. Kwadwo, Kyeremanteng. Thank you so much for being on the show. We appreciate you, and we will put the resources that you have mentioned available on our newsletter. So thank you. Stay blessed and keep blessing others.
Keep up this. This is beautiful, Dr. O. I'm just true privilege. You're changing lives. This is incredible.
Thank you. All right, y'all. So I'm just going to wrap up. Please note next week it'll be tea time with me. So that's where it's like office hours. Y'all can ask me, your questions. I'll be focusing on work-life balance. Spoiler alert, there is no work-life balance, but we're going to talk about that. Okay, so tune in next week to hear more. Thank you for watching and follow us on social media. Sign up for the newsletter, especially if you want to get all those resources and mentorship that Dr. K talked about. And I'll see you next Tuesday at 7 p.m. Eastern Time. Thank you and good night.